Thank you very much, Dr. Gibbons. We now move to Natasha Bonhomme from the Genetic Alliance. So we move from a leader in the federal research to a leader in advocacy.
Great, thank you so much, and thank you so much for having me here. I'm just going to jump right in. For those of you who are not familiar, Genetic Alliance is a health advocacy organization that actually is celebrating its 30th anniversary this year. It started off as the Alliance for Genetic Support Groups and was really the support group for support groups. So where people went to if they wanted to start a foundation, if they wanted to do more in terms of research or help around a particular condition. In our 30-year history, we've really grown to go even beyond that to a network of 10,000 organizations working around policy, advocacy, education, and really thinking about what are the science tools that are needed that really put people at the center. And so really for us, it's all about individuals and families and communities, and how do we build around them as opposed to trying to find a system that we can input those people into. So I'm going to talk about one of our tools that really demonstrates our philosophy about putting individuals and families at the middle of research. It's called PEER, which is the Platform for Engaging Everyone Responsibly, and it's a highly customized registry system that collects privacy-assured health information, and it allows individuals to set their own privacy settings. I think that's one of the things that we oftentimes hear in terms of one of the challenges in terms of consent, in terms of how do we know what people want in there, what amount of their information they want out there, what don't they want. This is really a system that's meant to be dynamic and to help people collaborate and come together, but again, keeping those privacy and health data sharing abilities to be really with the person themselves. Again, that philosophy is to create something that's highly engaging, that's intuitive, and consumer-centric. You'll often hear I won't use the word patient very often, but I will use the word consumer, participant, other words like that, because we think that that's really critical in terms of thinking that this isn't just something that's going out. It's not just a transaction of someone gives their data and then they're kind of left there waiting, that people are really participants in research and should be participants throughout their healthcare. Throughout their healthcare. Because of the way the platform is set up, it really enables all of these different continuums that are listed up here that I won't go through just for time. So a key piece of PEER is to create an environment of trust. And the way that we do that is that the portal is actually, it's not just called PEER, but once a community decides to use the platform, we allow them to brand it the way they want. It's really integrated into their website. That way, when people are thinking about joining, they actually see a familiar face, either literally a familiar face of someone who's in their community, or at least a very familiar brand that they're used to, either their healthcare group or their disease-specific advocacy organization. But again, it's all about having that trusted community who's offering the registry and the ability to share their data. That's what that shows here. This is just an example of how the PEER entry point is actually incorporated into a group's website from the beginning. Then these individual registrars are able to set their privacy preferences using something that we call privacy layer. This is guided through different guides, so each community picks people who represents the experience of the people or patients in that community, and you may have one person who says, I think everyone should have all my data, go for it. You may have someone who's a little bit more moderate and says, you know, on these issues, I'd like a researcher to ask for my permission and see if I want to participate in the work that they're doing. And then you may have another guide that says, this, for me, is a little tricky. I'm not really sure right now. I'm more on the conservative side. But again, it gives the opportunity to say that there are all these different options, and that is embedded into the program. I also wanted to point out that we currently are working with 40 different communities, and communities means a range of different things. So we have, of course, our disease-specific advocacy organizations that we're working with through a range of different programs, but we also have actually a community out in Pennsylvania that's interested in following the effects of fracking on their community's health. So quite a range, and that is something that we're really interested in. We want this program to be agnostic to specific conditions or condition types. It's really about people who are interested in their health and wanting to become more involved in research, to move from just having a range of questions of, I wonder what's going on here, and moving that to a place where they can actually have really good, solid data to build off of. So, as I've mentioned, privacy and making sure that health information is protected. We know that when people talk about privacy, what they're really talking about is trust. They want to know, can they trust a particular system? Can they trust that their information will be protected and used in the way that they want? When we've surveyed I want to say it's about 12,000 individuals now who are part of PEER, through their different community groups, what they think, how confident they are. Nearly 90% say they are extremely confident and have complete trust in the system. And we think that, yes, I think we built a really good platform. It's really because we work with the communities and that it's people that they're familiar with, that even if there is an issue, they know where to go and have that conversation. And we really think that's critical. So in the few minutes I have left, I'm going to talk about an example of how we are using PEER through our Community Engaged Network for All, or CENA. I will say, I think one of the things Genetic Alliance is really good at is a lot of new acronyms. It's a lot of alphabet soup, but hopefully you can keep track. But CENA is a program that was awarded through, or that's supported through PCORI. And it has its its phase 1 awarding, where we really went out and asked people, you think you want to do research? All right, let's do it. Let's see, how do we go and do that? And right now we're in our second phase of funding, to really have those groups who said, yes, I'm interested in research, those patient-centered communities really starting to go through the heavy lifting of saying, okay, the question you're presenting to us, it's not really a research question. How do we frame it so that the data that's collected can be compared to other groups that are collecting similar data? Again, a lot of the issues that we all know are really, can feel like the barriers in terms of actually having patients really and participants really be at the center of the research paradigm. And so using PEER as well as Mosaic, which is a platform from UCSF that is a way for clinicians and other stakeholders to collaborate on research design and determining what questions they're looking for. The groups that are part of CENA are creating their own community-driven, participant-driven research studies. So we're really excited about that and being able to share some more of the results of that in the upcoming months. So in closing, I think some of the challenges are that people still are not fully integrated into research or even into services. I think that people who have an interest, they don't necessarily know where to go. I really appreciated the comment at the end of the last session about, where does the consumer fit in and where do the caregivers and caretakers fit into all of this? That still is a big question. There's that need to build that trust and trustworthiness, that it's not just researchers are interested in our data and then they leave, and that's great, there's an article out there, but how does it affect my health today? And that the systems really aren't set up to do that work. But of course, there's a lot of opportunity, I think with the work of PCORI and PMI and a number of other initiatives. Engagement is a really big word now. People really are thinking about what does true engagement look like. We also are not just interested in big data and a number of data points, but actually what's the story behind that data. And lastly, I think we finally are at a point where there are some real life models in terms of patients and participants really being involved in research and what that looks like, what are the lessons learned, and that there really are going to be only more of those examples to come up. Thank you so much.